My name is Vicki. I thought I would share my story with you. I know if I'm going through it, that somebody else out there is going to be going through it as well. When I was 13 years old, I was hit by a car. I received multiple broken bones in my face and to other areas, but anyway, I've had a lot of partials in place of teeth that were missing from my car accident over the last 27 years. Over the years, things have broke, things have fallen out, things have been taken out, and because of the cost of teeth work, I've just been unable to afford to do what needed to be done, taking care of family, etc., etc. Now I have decided I'm going to go through with the cosmetic work, and I'm getting what's known as permanent dentures. If you've done your research about permanent dentures are a full set of dentures on the top and bottom. They are removable, but they are hard to remove. I guess you would think of them as they snap in and out. Regular dentures back in the days were kind of loose and they didn't fit real well. And, people had to wear denture cream and stuff like that to hold them in place. Well, years have progressed and technology has got better, and now they have these dentures that you can actually, they snap in and out of your mouth. They don't just fall out when you're eating, or you can't just pop them out with your tongue. It takes a little bit more work. So I kind of look at them as more a new age set of dentures. So I went to the doctor, and I started discussing some problems that I was having over the years. I was having a little bit of slipping, and my cheeks are starting to sag a little bit. My speech is starting to slur on a little bit now. And I actually have quite a bit of problem drooling at night from the lack of the teeth that I have. I have a full partial on the top that has started to erode, or if you would, it's starting to slip down a tad bit, so it's time to get it replaced. The dentists were amazed that I had had my full top partial for 27 years, and it's lasted this long. But like I said, other things have came up, and it's time to get all my teeth replaced. For many years, I haven't had any teeth on the bottom or in the back, so everything I've had to do in the front. Chew, stuff like that. So I've always had to be very careful as to how I ate. Chewing things up into small bites has always been a problem. I've always learned to kind of do things big or swallow big. Just be careful with what I do. So anyway, I went to the dentist and I discussed my problem with the dentist, and the very first thing that she suggested to me was the going with the permanent dentures because of my age. Now, this is a bit of a process. It is a very costly process. Right at $16,000 to have this work done. But again, you have to look at it in the long haul. You have to have teeth. And when you start having medical issues like I've started having over the years, you have to kind of consider, what you want to do. For us and our family, taking this small draw was what we needed to do. Also, before you make any decisions, sit down with your family and discuss it. Sit down with your dentist and discuss it, and they will walk you through step by step. What I did is, after speaking to my dentist and she assured me what needed to be done, I came home and have done a lot of research on the internet about it. I've looked at a lot of people's video like this that I'm doing for you guys. to see how they went about it and how they came out. From what I'm told and what I understand, my surgery is tomorrow. I have 14 real teeth that are left in my mouth, so they will be extracting all 14 teeth that I have left, and they will be emplacing them with 6 titanium rods or studs, however you want to say it. There will be 4 studs on the top, 2 studs on the bottom, and these studs, when the healing process goes on, they will put snaps on the end of the studs, and that's what your permanent set of dentures will snap to. Now, my very first visit to the dentist was about 3 weeks ago, and they took a molding of my mouth with what teeth I have left in it. Now, the reason they do this is to actually just get the size of your gums. We was a little confused as to how are they going to take a molding of your mouth and with teeth in it, and then they're going to extract your teeth, and that's supposed to fit. Well, here's what I was told. Basically, they just take the molding of your mouth to get the size of your gums. After that, when they do the surgery on your teeth, and they remove your teeth and they implant the studs or titanium rods, they place packing over that for healing process, because you'll have stitches and whatnot. Now, they will, if they need to adjust that set of dentures when they do the work, they will do it there in the surgeon's office, and you will walk out of there with a full set of what they called temporary dentures, also known as transitional dentures is what they call them. Transitional being because you're going to go through a transition process. Your gums are going to heal, they're going to swell, they're going to shrink, they're going to bleed, they're going to be sore, and so forth. So the temporary set of dentures is just so that you can heal, and that your gums have to have something on them so that you don't lose bone. Now, you just have to follow some simple rules and wear them for a while. Now, from what I'm told, they're not exactly very comfortable. You're going to have to keep going back and having them adjusted. So I'm not real sure. So this is just my first taping of this. I will update you on the progress. And like I said, so tomorrow will be my surgery date. I'm feeling a bit nervous, a bit anxious, hopeful, and about a million other feelings right now. So I just kind of want to share my progress with you, and as we go through, I will let you know step by step what they do and how it comes out, and pray for the best. So hopefully at the end, they say it's a 6-month to a year healing process from start to finish. So hopefully in the end I come out with a very beautiful set of permanent dentures. So I'll get back with you. Thanks.